So as a graduate student, as you know, I was in the health psychology and behavioral medicine track at University of Miami, and my principal training was in cardiovascular reactivity. So I trained with Dr. Neil Snyderman and Dr. Patrice Saab and Dr. Maria Yabre. And at the time I was very interested in how race and ethnicity might influence the physiological reactivity of individuals, and we were specifically interested in whether or not the race and ethnicity of and gender actually of an experimenter would influences one's physiological responsivity to stress.
I think one of the most instrumental experiences that I had was during my master's program. I worked with Bob Kaplan, who was the director of the Behavioral Medicine Research Center at San Diego State University. And so it enabled me to work on lifestyle intervention grants with him early on. I helped run about 5 different programs that he had NIH funding for. So it was an incredible opportunity and experience for me to have that hands-on opportunity. And I was developing weight loss programs with diabetics even way back then. And from there, I got into Vanderbilt University, where Ken Walston was my mentor. He developed the Health Locus of Control scale. Both Bob Kaplan and Ken Walston are social psychologists, so I'm really trained as a social health psychologist, and I really did not go the clinical route, even though I spent much of my time doing clinical interventions, so kind of unusual. But I really wanted to focus the majority of my time on doing research and primarily randomized controlled trials. So I felt like it was better for me to not get the clinical training, but to really just focus on the science and how to implement these large-scale trials.
But I decided on graduate school in clinical psychology, and I chose to go to the University of Florida in Gainesville, where at the time, this is 1985, had a unique program in which it was a clinical psychology program housed in a medical school, in a medical center, with other allied health professions, physical therapy and pharmacy and the like. And so it was really focused on clinical psychology and health psychology, and indeed later on the program renamed itself Clinical and Health Psychology. And so I spent some years there and became more enamored by the idea of what's going on between mind and body. Even did a dissertation on blood phobia. One studies what one struggles with.
So my training in health psychology in graduate school consisted of a lot of classes to give you that good theoretical background to understand all the bodily systems that are involved, and also all the major theories of change and health behavior change, and also clinical work. So doing practicums in settings like the VA or a cancer support community, and getting my feet wet in health psychology.
Both at the University of Wisconsin's graduate program in clinical psychology and at Temple University's graduate program in clinical psychology, I had excellent training in physiological aspects of behavior, on cognitive behavioral interventions in health settings, clinical rotations throughout both graduate programs that were in health and hospital settings. My research focused on very early studies of adults coping with breast cancer, ovarian, and testicular cancer.
So my training in health psychology actually started in graduate school, and that was at Ohio University. And the person who first trained me in health psychology was Ken Holroyd, and that was in the area of headache. I did not go to graduate school to do health psychology, although I had some interest. I really went to do psychotherapy process and outcome work. But as I saw what Ken was doing in his active lab, in his research studies, and also what he was doing in a small clinical area, I found that to be fascinating work. And so that was my introduction to health psychology.
So the program I attended, Ohio University, has a minor concentration in health psychology. So it's a clinical psychology program with an emphasis in health. And in that particular program, we have health psychology courses, some general overviews of health psychology, as well as health psychology interventions specific for clinicians. And so I took that sequence of courses. And then we also have several practicum experiences. Now, Athens, Ohio, where Ohio University is located, is quite rural, so we were somewhat limited in the options we had, but the faculty there had done a great job of creating relationships with the College of Medicine that we have there, and so we had a rotation in primary care. Also had a rotation in neuropsychology, which allowed us to do some work with cognitive assessment with medical populations, older adults in particular, and so I was able to have both those experiences. And then I actually drove up once a week during my 4th year of graduate school to Columbus, Ohio, about 70 miles away, and I worked with another health psychologist up there, Charles Emery, and worked in his rotation doing some pre-bariatric surgery courses and assessment.